I'm often asked socially what a holistic and functional psychiatrist does that's different from a conventional psychiatrist. And so I thought I would comment briefly on how my evaluations differ from when I previously did conventional psychiatry. I go into much more depth asking about physical symptoms in the body, in that they can point to root causes of brain-related symptoms. So, for example, skin-related issues often are telling me about someone's immune system and potentially their zinc level. And both the immune system and zinc deficiency play a big role and are very common in brain-related symptoms. So I ask about all the systems of the body. I also go through a detailed timeline, asking not just about moments of stress and trauma, but also about exposure and different homes, and try to see how that might fit into the progression of someone's mental health issues. So someone could be moving into a new environment and be getting exposure to mold or exposure to higher sources of EMF and not realize that that's contributing to their depression, anxiety, even psychosis. So beyond the evaluation, I also am doing more in-depth lab work than I would have done as a conventional psychiatrist. While I will look at the basic labs, things like liver and kidney functions, blood cell counts, vitamin D level, thyroid functions, I also will look at labs that I wouldn't have considered to look at in the past, plasma zinc level, serum copper, whole blood histamine is a rough measure of methylation. I might also do testing for mold toxicity or do testing to look at the microbiome. And the treatment, instead of prescribing medications to address symptoms, I'm providing vitamins, or what we call a nutrient protocol, to target those imbalances that are showing up. If someone has mold toxicity, I use binders to address that. If they have mold colonization, meaning they have mold in their sinuses or GI tract that's contributing to that toxicity, I will use antifungals. I'll use supplements and medications to help lower inflammation if that appears to be at play. So those are just a few examples of the types of treatment. I do also consider things like early attachment, trauma, chronic stress,